I nominated Sarah Linman, who's a nursing assistant on critical care, and Michael Porter, a nutritional assistant caring for older people on Ward 23. Actually taking the decision to nominate them was the easiest thing. Two exceptional members of staff who truly understand what it means to deliver care that is based around what the individual needs. And the thing is, they just do it instinctively and because they want to. When Roy Lilly came to visit our organisation, we made sure that he had a chance to meet Michael and Sarah, and he dubbed them Geordie legends, and we couldn't agree more. It's a great privilege to have them as colleagues within our organisation.
I nominated the Involvement and Service Development team in the Community Business Unit of Northumbria Healthcare. I think they're a fantastic team. They're very diverse. They have come from a broad background in health and social care, and I think that's one of their strengths. They each bring very different qualities, but they work together. They're very supportive as a team, and they use each other's strengths to produce something which is greater than the sum of the parts. I think they have a person-centeredness that goes through the core of every single member of the team. So they all strive to involve people. They see the importance of people being empowered and involved in service development. And I think the unique difference about the team is that they not only are very skilled at involving people in a number of ways, but they're also very innovative in thinking about how that then develops services. And we've got some great examples of that. Things like the Ageing Well programme, in which they listen to older people in communities, listen to what they want. They empower those people to do what they want to do in those communities to help them to stay healthy and well as they grow older. A good example of that would be things like older people from the dementia forums talking about concerns about giving up driving as they get older, and worries about using public transport. And as a result of that, we did training with bus operators in Northumberland as part of the Certificate of Professional Competency, so that all bus drivers will eventually become dementia aware and trained in that as part of their professional competency, which is a fantastic innovation.
This nomination came from Sunderland Clinical Commissioning Group, myself, Gloria Middleton and Lee Cooper, who have developed Sunderland Action for Health. We were really fortunate enough last year to receive some funds from the Sunderland Clinical Commissioning Group, who we've worked with in partnership, both myself, Lee Cooper and Gloria Middleton. We wanted to develop an accessible, interactive website for people with learning disabilities, their carers and all health professionals. So we hope the website is aimed at dentistry, podiatry, hospitals, GP practices, everybody that would provide a service to people with learning disabilities. On that website, they will find information about things they may experience, for example, coming into hospital and having an x-ray, going along to your GP practice and having a blood test. Some of these things are really scary for people with learning disabilities, and we believe if we can provide the information ahead of that, hopefully that relays some of their fears and they have a positive experience. Within the website, there's some software that we've built in that allows services to invite people along to their appointments in an accessible way. The letters are done in a pictorial format that again enables people with learning disabilities to understand what the procedure's about. We're also working with a company that will use software to narrate everything that's on that website. So if you do have a learning disability and you're not able to read, or you have a sight impairment, you still can obviously follow the information that's there. And I think what's been really fantastic for us as well is we've worked closely with a group of people with learning disabilities who are experts by experiences. They're critical friends, if you like. They keep us grounded, they look at all of the information and make sure it's truly accessible before we put anything on that website. So we'd just like to really thank everybody for the recognition that we've received.